Hi, and welcome to a new podcast of the IDS. In this occasion, we're going to discuss angioma and its variants. Angiomas and angiokeratomas are very common acquired lesions. We see them often with our patients. So, we want to learn the demoscopic pattern in order to reassure the patient and to avoid unnecessary biopsies. But also, and most importantly, in order not to miss melanomas that look like angiomas. In this webcast, we're going to discuss vascular lesions, including angiomas, thrombos angiomas, angiokeratomas, and angioma-like melanomas in order not to miss these lesions. Let's start with the dermoscopy of angiomas. The hallmark of angiomas under dermoscopy is the presence of red or purple lacunae, the presence of septae, and the absence of blood vessels inside the lacuna, which is a very important feature for diagnosing melanomas like angiomas. So we have lacuna, we have septa in this schematic, and on dermoscopy what we see is the same. Lacunae as these red spaces, septa in between the lacunae, and this is a perfect correlation with histopathology. On histopathology, we see these dilated vessels, which is lacunae, and the fibrotic septa in between the vessels. Let's see a case. This purple reddish papule on the thigh. On dermoscopy, we have lacunae and septa, classic features of an angioma. And this lesion was excised because the patient didn't like the lesions. We have histopathology where we have these dilated or ectatic vessels with fibrotic septa. This is the classic features of angioma with a perfect correlation with histopathology. Sometimes the lesions are not bright red, but more purple. And in these cases, you can also do diagnosis. So in this case, on dermoscopy, we have the lacunae, which instead of being bright red are purple, and the white septa in between the lacunae. Let's move now to thrombos angiomas. In this case, we have the presence of red or purple lacuna, same as before, the presence of septae, same as before, but we also can see dark blue to black, pitch black, dark, homogeneous areas. And of course, also absence of vessels inside the lacunae. Let's see some examples. This patient was referred for this lesion, which was very suspicious for melanoma clinically, but under dermoscopy, we have a classic feature of thrombos angiomas. On the left side, you have lacunae and septa, which are the remnants of the angioma. On the right side of the image, we have this homogeneous black area, which corresponds with the thrombos area. One more example, this multicolored papule on the abdomen, and on dermoscopy, we have lacunae, septae, plus this black homogeneous area that correlates with thrombose areas. Sometimes we only have this homogeneous black color when you have a thrombose angioma and you don't have any features of remnants of angiomas with the lacunae. Let's move now to angiokeratomas. And angiokeratomas come in different flavors. They can be solitary, multiple, localized, or diffuse. And we're not discussing each of them, but you can have solitary angiokeratomas. On the genitals, you have the angiokeratomas of Fordyce. You have congenital variants. You can have on the fingers, on the toes, and disseminated associated to systemic diseases like Fabry disease. And these are the different clinical variants. But on dermoscopy, most of them look the same. And on dermoscopy, we have the presence of dark lacunae, the presence of a white veil. Also, you can have red lacunae and septa. Let's see some examples. In this case, you have the presence of a whitish veil on the central portion and dark lacunae. And the combination of dark lacunae plus whitish veil is very suggestive of angiokeratomas. In fact, studies have shown that the combination of both has a sensitivity of 84%, but a specificity of 99%. And these two features, the whitish veil plus the dark lacunae, correlates well with the features seen on histopathology. So on histopathology, what you have is the same dilated vessels as on angiomas, but also you have here the presence of acanthotic and hyperkeratotic epidermis, which explains the presence of the blue-white veil. So this acanthotic and hyperkeratotic epidermis correlates with a whitish veil on dermoscopy. Let's see one more example. Here you have the dark lacunae plus the whitish veil, angiokeratoma, and this again is very specific, 99% for the diagnosis. Let's see one example. Again, angiokeratoma of Fordyce. This is a classic clinical features or syndrome where you see these angiokeratomas on the vulva or scrotum on adults, and you're gonna see the dermoscopic features are almost the same. Let's see this close-up for the same lesions here on the scrotum, and on dermoscopy you have the same. The presence of purple lacunae, dark lacunae, plus whitish veils, but also you can have all of the classic red lacunae. So this is a spectrum of disease, right? Angiokeratomas can have purple, red, and whitish veil. One more example where you see this red lacunae on the scrotum. And again, in this case, we had confocal microscopy, no histopathology, but you see on confocal microscopy is exactly the same. The dark lacuna correlates with dilated vessels, and the septa here seen on this RCM image. So we have now reviewed angiomas, thrombos, angiomas, and angiokeratomas. So now let's see what about melanomas that look like angiomas. So melanomas that look like angiomas tend to have lacuna-like structures. And lacuna-like structures are characterized by septa not visible, by the presence of vessels inside the lacunae, by a chaotic distribution. They might have remnants of pigmented structures, and some of these structures, these like lacuna-like structures, have been termed milky red globus sometimes. So when you have read milky red globus on papers, it might be referring to these lacuna-like structures. So let's see this example here. You might confuse this with lacunae. So we call these lacuna-like structures, and we know they're not lacunae because you have vessels inside the lacuna. Remember, I showed you that angiomas cannot have vessels inside the lacunae, where melanomas can have these vessels inside the lacunae. And again, not true septae. These are just fibrotic stroma in between these lacuna-like structures. But also, melanoma metastases can have these vascular lesions that mimic melanomas. So this is a description of the different dermoscopic features of melanoma metastases. And as you can see here, there's one angioma-like melanoma metastasis, and this can mimic angioma, but of course you have the context of a patient with metastatic melanoma. So these are the different variants of melanoma metastases, and here you have the angioma-like melanoma metastases, which has these lacuna-like structures. Here in this example, on the top row, you have two angiomas with red and more dark lacunae with septae. On the two examples on the lower row, you have these melanoma metastases with these angioma-like structures, which, as you can see here, is very hard to differentiate. But the most important feature is context, right? So when you have a patient with history of melanoma, you always, if you see a new lesion, you always need to rule out melanoma metastases. Again, another example, in this case, you have these lacuna-like structures and not really septae, plus vessels inside the lacunae. So this has been termed also milky red globules that can resemble lacunae. And this case was a amelanotic melanoma metastasis on a patient with history of melanoma. And one more example here, is this really an angioma? It's a new lesion on a young lady. It might be, from a clinical standpoint, you could think of an angioma, but what do you expect to see? You expect to see lacunae and septae. And in this case, you have this pink lesion with no lacunae, no septae. It has shiny white lines and it has vessels. In this case, we did a biopsy, and this was a Spitz nevi. So remember, whenever you see a pink lesion, you expect to see lacunae and septa. If you don't see this clearly, you need to rule out a melanocytic lesion, which could be a melanoma or a Spitz nevi. So summary, angiomas show lacunae and septae. Thrombos angiomas show the red or purple lacunae, septae, plus its black homogeneous areas. Angiokeratomas show dark lacunae plus blue-white veil. And melanomas that mimic angiomas have lacunalike areas, also termed milky red globules, no septa, and vessels inside the lacunae. We're going to switch gears now on the final part of this presentation to review how angiomas look on special locations. And when we say special locations, we're going to discuss the acral surface. This patient with history of melanoma had this lesion on the sole of unknown duration, and on their Moscopy, you see this. The presence of red dots along the ridges in this organized pattern. And this has been termed double red dot ridge pattern and is classic as a classic feature of angiomas on the acral surfaces. Another example, you have the same red dots along each side of the ridge, and this has been termed again double red dotted ridge pattern. Another patient with this lesion on the sole of unknown duration. On the Moscopy, you have exactly the same red dots along each side of the ridge or double red dot ridge pattern. And you can have here how the ecrine openings of the ridges are spared. These three examples represent angiomas on the acral surfaces. But what about amelanotic melanomas on the acral surfaces, right? And they tend to see similar features, but in a more disorganized pattern. So in this case, you see irregular red dots on the ridges. So this has been termed the atypical double red dot ridge pattern. And let's compare both. So on the left, you have a melanoma. On the right, you have angioma. As you can see, both have these red dots on the ridge, but melanomas tend to be chaotic or disorganized, and angiomas tend to be organized. In this study that include 14 lesions and tried to characterize acral angiomas, the double red dotted parallel ridge pattern was the most commonly seen feature, but 15% of the cases had classic lacunae and septa similar to non-acral surfaces. And of course, melanomas tend to have this chaotic or disorganized red dotted ridge pattern as I showed you before. Thank you very much.